Welcome again to all of you for joining us in this webinar on resonance and healing healthcare. I'm Ginny Whitelaw, the head of the Institute for Zen Leadership, and I'm really privileged to be joined today by several colleagues in healthcare, working in healthcare, seeing healthcare from a lot of different angles. And I hope in this time together that we can bring you something that helps you in this time, whether you work in healthcare or running up against the healthcare system. We really hope to share with you some of what's going on, some of what we can do, some practices to resource ourselves for resilience, and I'll say change adeptness in this time. Joining me today, Dr. Adrienne Hampton is co-hosting with us. And Adrienne, let's get a spotlight on you. Adrienne is a physician in family medicine at the Department of Family Medicine and Community Health at the University of Wisconsin. She's also one of our Zen Leadership and Heal instructors at the Institute for Zen Leadership. Welcome, Adrienne. You have some opening comments for folks?
Thanks. Yes, so as we think about our webinar format, just thinking about how we're going to get the most out of our time together and still be able to communicate and share ideas bidirectionally. So if you have comments, inspiration that comes up from what you're hearing, what you're seeing, please feel free to use the chat for that. If you feel like there's a piece of the conversation or a piece of the picture that could make the webinar experience deeper, more complete for folks, if there's a piece of the conversation we're missing, then please put in the chat that you'd like to be recognized to speak, and then we'll give you the floor. We have limited space for that, but certainly we'll invite it if there's something that you think would benefit all participants to be heard aloud.
Thank you so much. Thank you, Adrienne. And thank you for joining in this webinar today. I'd also like to introduce our other, I'll call them panelists. Are you a panel when you're on Zoom? I don't know. The other speakers who are joining us today. If we could have the spotlight on Dr. Alex Adams, please. Alex Adams is a physician researcher. She's been training in Zen and Zen leadership for maybe 7 or 8 years now, and has more than 20 years of working with indigenous communities and working on wellness, promoting wellness. She really works in the research end of healthcare and putting together the researchers, the scientists, public health, and clinicians, and joins us today to talk about change in those areas and her work with indigenous peoples. Also joining us today, Dr. Christy Grimes. Dr. Christy Grimes, if you could spotlight Christy. She joins us from the Department of Medicine at Cox Health. She teaches residents there as well as a family physician. She's also one of our Heal and Zen Leadership instructors, and we welcome you, Christy, as well. I know things are ramping up in Cox Health with the COVID, so I know it was hard to get away for all of our physicians, and super appreciate you joining us. We could spotlight Dennis Tierman. Dennis is one of our instructors, also in Zen and Zen Leadership, has been training with us a number of years and teaches in our HEAL program. He also works with healthcare from another angle. He's a coach and consultant to healthcare and has worked for decades with different health systems and is now seeing unprecedented kind of change. So can really speak as somebody who's worked across the industry. Dennis, thank you so much for joining us and for all you've done for the Institute over the years. Great to have all of you. So I'd like to, before diving in with questions for our group here, just frame up a little bit of what it is we're talking about and why it is we even talk about resonance with respect to healthcare. What on earth would resonance have to do with healing healthcare? Let me share just a few thoughts with you, a few slides to frame up our discussion, and then I'll be turning it over to questions for our different folks. So I'd like you just to, I said to take a deep breath, but you could just settle in this time. It may be a hectic time for you. I know it is for so many people, a time where it's almost hard to catch our breath. So maybe you can hear this spring bubbling along or this fast moving water. I'm going to use it as a backdrop for talking about a couple of things. First, we're going to hear a lot in this workshop, or webinar, not so much workshop, but webinar, about energy. You'll hear me talk about energy and resonance as a way that energy changes form. and to just ground us in what I'm talking about with energy, as if it's not solid, liquid, or gas, which we would consider forms of matter. It's a form of energy. And in fact, even those forms of matter are, in a sense, compressed forms of energy. So energy is everywhere. Energy is everywhere. And resonance is how energy changes form. So you think about what goes on in healthcare, the feeling of a relationship between a clinician and patient, or a clinician and someone they're mentoring or teaching. That's an energetic quality. Every encounter between people has an energetic quality, a team climate, a culture, what it feels like in this country right now, what it felt like in April, what it feels like now as we nearly enter July. Those are all forms of energy. And the way we work with energy comes through the human body, because you and I are both energy and matter. We're at the intersection. We have solid parts, liquid parts, yes, gaseous parts, and a lot of energy, a lot of energy. So to make a difference, whether it's in healthcare or any dimension of our life, is to, in a way, channel the energy around us into things that matter, into the difference that is ours to make. And how we do that is something we have considerable choice about. How we do that, we have some choice about. So this is where it comes to Zen training and Zen leadership, and why there's a connection to the work we do at the Institute. Let's go back to that river. Let's go back to that fast moving water. And you see here, I've thrown a little ball into it. You know, if you look at that little ball on fast moving waters, can you picture what it will start doing? How is it going to move with that fast moving water? Can you picture what it will do? Well, sure, if you've got some imagination, you can see how it's going to start rolling and turning and bouncing off rocks and going with the flow of things. But now let's imagine we throw you into fast moving water. What are you going to do? What are you going to do? For so many of us, it's a struggle, it's a fight, it's a what's going to happen to me, it's a fear. If you look at the fear coming out in this time, so many people are worried that they won't be safe, they won't get enough, they won't be okay. They're in the fast moving waters of COVID, and it's frightening. Whether they're a patient or a physician, whether they're trying to figure out how to take care of their communities, it's frightening. So what does Zen have to do with this picture? Well, we often say in Zen, it's like being more like the ball on fast moving waters, being agile with fast moving waters, being able to work no matter what happens with the energy around us. And we can literally physically expand the range of energy we can work with by how we tune this instrument that's you. On the one hand, we can be very tight and constricted, where we're really full of denial and blaming and anger, and that's an exhausting way to be. At the other end, we can be open and expansive and very sensitive, and being able to do our craft on purpose. And it's a very joyful place to be. At one end of the spectrum, it's about getting through our day. At the other end, it's about breaking through in the relationships we're a part of and in what we endeavor. Now, of course, having framed it that way, you think, well, everyone would want to be on the breakthrough, joyful, on purpose side, wouldn't they? But the truth is that what we sense is the energy we get to work with. And then how we take it determines where we're going to fall on this spectrum. How you take it, how you take what happens around you is where you're going to fall on the spectrum. And that's true for all of us as human beings. And the spectrum is not really a straight line. It's more like, if we look at what goes on between coping and creating, there's a critical inflection point, kind of a 0 point, if you will, between negative and positive, where we reach a 0 point of just clear acceptance. And acceptance does not mean I like it. It doesn't mean I'm not going to work to change it. It doesn't mean it's okay just as it is and I don't have to do anything about it. Acceptance means I see it. And I see the forces that have brought us here. And fearlessly, I can lean into this. In a way, it's not about me protecting myself. It's about using myself to co-create the purposes to which I put this instrument. That's Zen leadership. It's that cusp that turns it into Zen leadership. And I just wanted to frame that up because it's really that capacity that we want for all people in this time, to be able to be fearless and to take fear out of the situations and make things better. Now, how do we make things better? It starts inside out because we're the instrument. We're the one conducting the energy, figuring out what we can work with and changing things. And we can change things at several levels. We can change the relationships we're a part of, as well as the systems or even the whole society, where we get into these structural changes. And change at those levels has more endurance even beyond our lifetime. Likewise, the amount of energy it takes to make those changes increases the more bodies those changes are stored in. So there's something very special, potent, and ripe about this time where so much has been thrown up in the air, including in healthcare. And that's what we'd like to explore with you today, is how can we use ourselves as instruments of change? How can we resource ourselves? What are some examples of things that are happening? And what you'll see is that even though resonance is a physical fact, the sound comes forth. There was no choice in whether that sound came out. That's how resonance works. If things vibrate, if you can vibrate with, you do. But how we resonate with and the breadth of energy we can take in and work with and how we work with it is where we have choice. Physical practices, such as we'll share one with you, a couple with you today, help bring out our more resonant self. And that the healing we're able to put into the world starts here, starts there. So we'll explore in this time together how a connected, non-dual perspective looks even at this wild time in healthcare, how we can look at 4 levels of change: self, relationship, systems, and the whole society, and how physical practices can resource you to be a more resonant instrument of change. That would be our sincere wish for each and every one of you. So with that, let me stop sharing the screen. And I'd like to throw out a question here and turn to people who know a lot more about healthcare than I do, know about healthcare as insiders. When you think about this incredible time of COVID-19 and changes in healthcare, what ripeness for change are you seeing? And how can we play with this? Or how does Zen or Zen leadership look at this kind of a matter? What's ripe for change in healthcare? Who would like to take that one on first? It's ripe for change. Yeah, great. Dennis, you're in the spotlight, so thank you. Go for it.
Well, one of the things, I work in a couple of healthcare systems now and have for about the last 12, 13 years. And I'd have to say, in that time, I've never seen a time that systems have been more open to change. I think the situation that happened with COVID really brought a shared experience together for people in a way that they really haven't had before in their careers. It was a crisis. They could all resonate with that situation, that something really critical had to be done, something major had to be done, something they'd never seen before. So they shared a level of uncertainty, certainly not shared with others before. Maybe they felt it individually before, but certainly not as a system. So I think that experience had ripened people for making changes. And I think it's clear that to survive those situations that came up through COVID, they had to change. Clearly, they couldn't have patients normally the way they would in their systems. They're still, even though they want to snap back to bring in the volume of patients in those systems that they had previous to COVID, that's still not quite possible because a lot of patients aren't ready to come back. So simple things, obvious things like virtual care, telemedicine began to get real play. You know, most systems I've been in and talked to about that situation said they've been trying to do it for 5 years, couldn't get reimbursement from CMS for it. Now they suddenly can. So they begin to see that that's a possibility that will last, an innovation that will last. And I think once you have that kind of innovation in a system, you begin to have changes to how care is delivered, significant changes to how care is delivered. Also see that because of unemployment, that there's going to have to be a real major change in the way healthcare gets paid for. If people don't have employment, they likely won't have insurance. And there's going to be major changes to how payers begin to get interested in actual innovations in the way that healthcare gets paid for. And you're beginning to see more interest in population health strategies. You know, it's been around for years. It's not something that's new, but I think there's new interest in it. And I think that's great. I think that's going to help a lot of the health disparities that we've seen in our country that COVID's really pointed out and had made a stark reality that nobody can deny at this point.
Right.
Certainly that's not the same everywhere or in every region. I mean, you can hear from Alex about how it's different out in the West and in rural places, but it really, I think people are ready to make the kind of significant changes to actually continue to be sustainable. And that means they have to operate differently. And I've just seen people, individuals and systems, operating more collaboratively. They've shared the stress of being in that COVID experience. They really were collaborative in those times in ways that they hadn't been before. And I think they see the potential for that, even though they're snapping back into more typical situations and behavior with the demands of more patients coming into systems. They see what they were able to do before and really have some hopes that the collaboration can continue. And frankly, that's what my work has been, as I've helped some groups be able to actually look at the possibilities for higher possibilities for collaboration.
Great. Thank you, Dennis.
Sure.
You mentioned Alex out west. Let's turn to Alex out west. What changes are you seeing? What has been your experience in this?
Well, it's a really great question. I think one of the things we've seen is that invisibility of public health has now been raised to this huge, there's a big difference, right? Public health is this thing that when it's working, nobody knows it's working because everybody's doing fine. When you take it away and when you destroy the system, you see what happens when a really big epidemic happens. So I think that people have been starting to realize that that's a really important piece. And we see that even out here. I think with Dennis mentioned the CMS payment, and of course we've been trying to get good healthcare in rural areas that is telemedicine for years and years. And so I think that is going to be a really important innovation for the really critically underserved rural areas. Doesn't necessarily help the tribal communities because they're under a kind of different medical system for the most part, and they're running their own clinics, so it's a little trickier. Indian Health Service has certainly, again, been left out of the loop in this whole time. The money that was given to many under the CARES Act was not given directly to the Indian Health Service. It was given to CDC to give to Indian Health Service. Well, CDC and IHS don't have any relationship. So that's been a disaster. And that's taken actually a legal battle for that money to get released because CDC had to do grants to get it out the door. Well, if you're in the middle of a crisis and trying to set up remote hospitals, writing grants is just ridiculous. So that's been tricky. The other piece that I've seen, and I'll say this with Dennis, one of our health systems here was never wanting to collaborate with the university, and basic science and the university were very, very separate and didn't think they had anything to offer to each other. Well, the hospital wasn't doing any COVID testing. It was all being sent to the state lab, which was overloading the state lab. And I knew that we had basic scientists on campus that had machinery and ability to be able to do the testing. So we got them to talk to each other finally and go, oh, look, we could actually do this. And that was a really big win. So there are pieces like that that I think hopefully will be enduring in terms of the university has something to offer to and we see that with universities all over the United States now, offering things to their communities that maybe they weren't in the past, even non-medical school universities like ours. So I think that's a good thing.
Adrienne, can we turn to you? What are you seeing in your system in terms of ripeness for change, what the crisis has brought out from people?
I see my system sort of finally acknowledging in a systematic way that social determinants of health determine outcomes. And if we start with a patient walking in the door, we're already behind the curve. And so I see my system grappling with that. Now, do we have all the answers? Certainly not, but that is something that's come to the forefront. How can we collaborate to address the social determinants of health that drive outcomes before patients ever even get to us? And so I see our leadership looking for more diverse perspectives in all sort of all arenas, administration from the ground up. And so that has been really encouraging. The Department of Family Medicine, remember, they had a diversity committee and have been asking for recommendations. And so, you know, it's been really heartening to see these issues in health disparities being directly addressed.
Yeah. Christy, let me turn to you. Same question. What are you seeing right for change that the crisis has brought out in your system?
It is such a good question. And ripe for change. I think one thing that I'm seeing is a recognition of the like the fundamental response of the care providers. So the physicians, the providers, the nurses, everyone had a fundamental response to help and to put themselves in harm's way. And you know, it was, I think, recognized, finally seen that that is what is, you know, true and fundamental to us. And it was depended on, it was so necessary to meet the moment that it was like there was this shift in energy or power, in that the administrators now realized, oh, here is the thing that makes this work. You know, here's the thing that is what is needed, that is true. And so I think there was finally somewhat of a recognition of, you know, who we are, why we're here, you know, to society, to the system. And so the ripeness for change in that, I think, is our being the physicians, the providers, the healthcare, you know, professionals, that we should be in those leadership positions. We might, you know, things might go well if the person who has a fundamental part of them that meets the moment, that meets the need, they're probably going to make some pretty good decisions for the community. And at least in our system, I have seen probably an elevated level of appreciation and respect for physician leadership. And that would definitely be a change. So I think, yeah, that's probably one thing that I have noticed among many, but.
You know, we've noticed this in our HEAL program, which is Zen Leadership for healthcare practitioners and practitioner leaders, that a lot of physicians and other people in healthcare don't think of themselves as leaders. And they think, oh, leadership, that's for those administrators over there. That's a different breed of animal. So I find what you're saying so interesting, where when you really peel it back, people are realizing what this crisis has brought out of people is the heart of who we are, and the heart of who you are as practitioners, and that it's and that should be the energy that leads forward, right? That should be the energy that really leads. You know, Dennis, you were kind of touching on this earlier about how the remuneration in healthcare is one of the things that can drive so many behaviors, and how even that is changing. You know, in Zen, we sometimes say something has to die before something else can be born, right? I would just say, when you think about the reward systems in healthcare, or kind of how we got here, what has to die for the right thing to be born in healthcare. If you had to say, what do we have to just let go of for the right things to emerge going forward? What would you say? See, Christy, you're still in the spotlight, so I don't know if you want to take that the first crack at that, or if you want to pass. But
sure, no, that's to be honest, that is a really hard question for me to answer. I think what has to die? Profit-based medicine has to go away. So generating income for insurance companies, is how we got here. So it's, just the natural consequence of that is why people suffer on so many levels. And there's just so many downstream effects of that, just one being the productivity aspect that has become such the status quo in clinical practice. It just undermines really all the things that are important to a healing relationship.
yeah,
And it's distracting, and it's a little bit seductive for some people, because there's profit and there's, maybe you get a bigger bonus. I just got a bonus from an insurance company yesterday for taking really good care of their patients. And there was a moment where I was like, oh, what did I do? I'm going to do more of that. And no, that's, it's so seductive. Money. And so that has to die. And the other thing that has to die is the structure of, well, this is also downstream, is the administration's role in making decisions for patient care, because they're too separated from it. So of course their decisions, their solutions are going to be misguided because they aren't in the exam room. They're not face to face with patient suffering and responsible for it. And so those are the people, the individuals who have to be responsible for the solutions. And so whatever makes that happen, or whatever's stopping that from happening, has to die.
thank you. I saw some thumbs up from your colleagues there. Adrienne, do you want to add to that?
I would second all of that. I would also say there are some cultural norms that you can't just kill a cultural norm, but I think as society tackles problems and evolves, we can see these shift. And I think one is sort of that healthcare is individual. Again, getting back to like social determinants of health, we need a culture and leadership that values health, not as a personal choice, but as a societal norm. COVID-19 has demonstrated that health is not an individual choice. We are all affected by each other's health behaviors, health beliefs, health decisions. And so just really cutting this notion of separateness, and that, this community can be healthy and it doesn't matter what happens to this community. I think COVID is helping us understand that can't be true and has never been true.
That's so powerful. You say cutting the notion of separateness. We might say cutting the delusion of separateness, right? Because it's showing us the connection, but of course the connection is always there, interpenetrating without obstruction. We belong to each other. We belong to each other. And it took a virus to show it to us in a new way, but boy, that's so powerful. Health is a societal norm. Anything you'd add, Alex or Dennis? Anything else that has to die we haven't covered? Have we killed it all off?
I'll add, I think the sort of the illness focused healthcare system, focusing on particular individual illnesses or things for treating rather than a focus on wellness, is a really, really dangerous. And that's in that same individualistic concept of not understanding that we can all be well, but only if everybody's well. And that's all the social determinants. It's all the other pieces that happen outside of that exam room before anybody gets into there to see us. That's the sort of tip of the iceberg. So I think that's a concept that we still don't have in healthcare, that it really should be about promoting wellness. It's usually about just treating the end game, and that can be really problematic, I think.
Let me use that as a segue. Yes, you've done a lot of work in this area, Alex, about promoting wellness in tribal communities. How are you approaching it? I want to kind of shift to how can we make change? You know, I talked about these different levels of change, from personal to relationship, system, society. As you've worked to make change, how are you going about it?
So again, so I'm a partner to many communities, so I'm not a part of these communities, but I've learned so much from them, and so grateful for all of the teachings that they've been willing to share with me over the years. And one of the major lessons, I think, is understanding that the collective health of a community is really driven by that community. And while there's a lot of outside influences, of course, economics and all of the other, things that happen, but to really have change happen in the communities that I've seen make change, it's really coming from individuals. And just like in that diagram you had, that change relationships to each other, to their families, to how they view the world, or going back to some of their more traditional practices, and then changing the systems in which they have been told they had to conduct themselves, and are now reclaiming their old systems that work much better and are much more communal. So, doing simple examples like public health seed distributions of let's have everybody gardening, so we're going to give everybody seeds, versus 5 years later realizing that wasn't so good, working on traditional blessing of the seeds and bringing back seeds that people had stored for hundreds of years, and talking about the relationship to the stories, and having ceremony around the giving out seeds. A lot more people are gardening. Those are very simple examples, but those kinds of wellness pieces that have to do with understanding that wellness is really about mental, physical, emotional, and spiritual health. And if those are not all connected, then a person can't be well. So that's how I've been learning and working with people in terms of how do we heal those pieces. And a lot of it has to do with looking at culture. Adrienne talked about culture, and our society is, and with the exception of particular pieces, we have a real cultural lack, and that's really hurting us, I think, in terms of understanding our history, our connections to the earth, to land, to who we are, and that's really broken, and makes people much more fearful.
It makes me, because they're separate. I mean, again, they're back to that delusion of separateness. When you live in a delusion, you're pretty vulnerable. That's so powerful. It's so powerful. Christy, you're also making a lot of changes in your system. Could you speak to a little bit about what you're doing to go about changing from inside out, from yourself outward? What do you do? How do you approach making a better healthcare system?
It really has started, individually. It's hard for me to connect the changes that I make internally with what happens around me, I think, because it's on I think an unfamiliar time scale, and also it's so incremental at times that I change fundamentally. I get rid of the things that aren't serving, and then things just happen. You know, so I don't necessarily code that as I changed this and then this other thing happened. It's that things are just happening, probably as a result of, you know, the work I've done individually in Zen and Zen Leadership. But one thing that's been really cool is that I happen to work with other people, a few of my colleagues who have also gone through the IZL programs. And it's a different kind of support for change. It's, how do I say it? It's not obligatory. It's not, I'll do this because we're friends or colleagues. It's a joining of perspective and intention that makes it into something that's completely different than what it would be if it was just me getting help from someone out of that obligatory way. It's generative, it's creative. And, you know, something that has come out of this has been a real strong intention on my part to line up my own life with my values and to get real clarity about those values. And then also what we do as a program and as a health system, and to get clear on those values. And then how do we teach those? And that's just been really rich, uncharted territory for the structured way of teaching medicine in a residency program that is very, you know, there's governing bodies and requirements and whatnot. So the way that I've approached change, I think, has been to really control the things that I can control, which would be my breath, my posture, my level of connection, integration of my own system, so that what comes from that is trustworthy, so that I don't have to second guess and wonder if what I'm creating and the ideas that I'm having, if they're good or appropriate or what's needed. You know, I can just trust the field that that comes out of. And it's very freeing, and it's not hard, and it's a lot of work, but it's not a burden. And so, yeah, it's like telescoping, you know, you come back to your breath and posture, and then it goes out to the entire universe, and then it goes to a meeting, and then it comes back to your breath and posture. So
I love it.
No idea if I'm answering your question, but
No, I love it. I mean, it really speaks to how fundamental it is, and yet how expansive and transformational it can be to go from obligatory to generative. Dennis, I wonder if you could chime in here, because I think you've had some similar experiences with how you've used the training to help systems in healthcare change, or how it's changed your work creating change. Anything you'd share?
Yeah, I just love what Christy was saying, because it's at such a basic level. And I don't know if this is, I just say it, I try to be an integrated whole within integrated wholes. You know, by that, just trying to bring my mind and my gut together and my heart with that. And I try to get out of the way, frankly. And one of the things that's pretty clear to me is the boundaries are where we have to do the work. And I think there's all kinds of boundaries. We have organizational boundaries, but there's also clubs. And what I would say is, wherever you see a boundary, make a bridge. You know, that's what I'm trying to do in terms of the work I do with clients and their systems. And Rebecca said something the other day, Rebecca Ryan, who's a colleague of all of ours. It isn't just that the future happens to you, you happen to the future as well. And I think when we have these perspectives, it opens up all kinds of possibilities that if you're only thinking about yourself or you're only thinking about your group, really limits what's possible. So as I enter these situations, and as I, you know, I have to do breath and posture. I mean, that keeps me out of my head. That keeps me managing and leading through fear. But I'm also looking for the possibilities of making connection. And that's really been a big change in my work. And the way I look for the possibility of making connection is the question we often raise is what wants to happen here, not what do I want to make happen here. You know, you kind of have to get yourself out of the way to be able to see what's present. And that has been, I think, enabled a lot more possibilities, larger possibilities, helping others. They sense your people in your presence, and I don't want to make this sound egotistical, but they sense that there is possibility. They're encouraged to talk about it from their own perspective. And if you actually talk about breathing and their body, you know, if you actually raise those topics with them, they begin to develop some practices as well that and expand that.
That's great. Thank you. Thank you so much. And you actually created a great segue to go to Adrienne now. We want to share some practices. We promised we'd give you some practices. So I bet you're not going to be surprised that they have to do with breath and posture. So Adrienne, why don't we spotlight you? There you go. How about could you briefly review the Hara breathing we did a couple weeks ago, and then we're going to add something to it. We're going to add some sound to it this week. So I invite you all, rather than sitting there, stand up, and you can play along with Adrienne. So go ahead, Adrienne. And I'll give some voice to this as well.
All right. So I'll just preface with, this is brief and available throughout my day, and I definitely use it. So with that.
There you go. So she's stabilized her base. She's taking in a big inhale. I invite you to do the same. Big toes plug into the earth. A long, slow exhale down through the hara, the lower abdomen. Knees are soft. Eyes are 180 degrees. Big inhale, so the hara expands as if you could breathe in from the base of the body. Inhale, as inhale turns to exhale, palms to the floor, big toes connect, breathe down. Exhale, you notice, is longer and slower than the inhale. Now arms drift up, big toes connect. Eyes 180 degrees so she can see both hands same time, just as you can. The first one, up and down center, really establishes that hara base that gives us enormous resilience. Extend, expand, gives the bigness to reach that energy into every situation that calls for it. Establishing the base, the hara, which develops and connects before the ego. Something connected in us. Big toes, big presence. Great. And then to start working a little more internally, we can use the vibration of sound. So let's just use the sounds that we'll use E, A, and O, E, A, O, to just feel where they're vibrating in the body and see if we can use that vibration to shake out a little bit of inner tension and relax even deeper into the sound. Thank you, Adrienne. How about one more exhale? Do E-R-O all in one exhale. And let's see if you can get a feel of how the sound just drops through the body. E-R-O in one exhale. You mentioned, Adrienne, at the start, you said you do this every day and that you find yourself doing this in the day. What do you find it does for you? I'm just curious.
Well, I do the breathing every day, and that is something that feels really accessible at work. The vocalization I do at home, but you know, that could change.
I think you're going to run the clinic, aren't you? I think you can do whatever you want there.
Yeah, basically. But what it does is take me out of my small body that is often tense and a little guarded and a little fearful. But you know, that's a place that I find myself a lot of the time. And to be effective, you know, I need to break out of that, and it's a constant practice. To go from being sort of this small, hunched, protected posture to just this big, open, receptive and engaging posture. And loosening up through the core, making sounds that you probably haven't made before, but that helps me get there.
And what changes when you bring that to a patient or a colleague's interaction or something? What changes in that interaction? Anything you notice, or?
Well, I can bring myself. So there's that. I just feel free to be myself and say what comes up and feel what I feel, and trust the messaging that I get in the interaction. Christy was talking about trust. You know, we have a lot of information that we can access when we trust that it's information and it's true, it's valid. And then I think too, it just makes me so much more receptive and able to pick up cues, to pick up sensation. It's like opening up an antenna, so that I get more to work with.
I get that. And I love how a number of you are bringing up this idea of trust, and that when the body's in the right condition, the body, breath, mind, body, heart are all together in the right condition, we can trust what's going on, you know, because we're plugged into it. It's really, it's great. Christy, if I could turn to you, when you're in this kind of condition, anything that changes in your interactions, or any suggestions or practices you'd offer for connecting with patients or residents that you're teaching? Anything that you find yourself doing that helps build that interconnection?
I find that I've become kind of creative in how to do the sounding at work. There's one bathroom that's up on the second floor that I don't think
for people.
It probably makes for a good story, but for somebody. But I've just found that the sound is so efficient and effective at clearing out the tension and also letting me know, where am I? So, you know, if I know what my awe sounds like when I'm all up in my head and I'm stressed and I'm not connected. And so it's like immediate feedback. I don't have to figure anything out. And so then I know, because of the practice, how it feels to get it out of my head and into my body. And I mean, it's like some secret trick that I don't know why we don't learn this as like in kindergarten.
Or medical school.
So I find, I'll go on walks, like around the clinic. If I have a minute, I'll just like go for a walk so that I have a chance to at least do this. Maybe not so loud, but at least to some extent so I can feel it in my body, because it just really is such a good tool. And then but beyond that, before I go into an exam room, I take a moment to just check and notice if there's any flexural tension. So is there any like subtle this happening, which it's usually just like a minute, I mean, you can't see it. It's usually just a minute millimeter of tension, but the training has helped me know that that's there. So I check that before I go in. And then when I go into the exam room, I hear Ginny's voice saying, relax, enter, and add value. And that just is like permission to not be an expert, to not be in control of this person's health. It's just, how can I show up? And that has honestly changed the trajectory of so many visits. And I find myself having conversations and that are just completely unusual and nothing that I would have planned. So it just emerges, and wherever that's coming from is way smarter than I am, because it's way more effective than the algorithm that I had before going in. And so, and I could do that all day. So the visits are not draining when I'm able to do that. I can't say that that happens every time. It definitely doesn't happen every time because I forget and I get busy. But when I do remember, yeah, it's such an effective tool.
It's, yeah, that relax, enter, add value, which we call it in the first flip of Zen leadership. That's at that cusp where we go from acceptance, which is the physical relaxation, into how we can lean in and add value. And I love your story around it, Christy. Thank you. Alex, let me turn to you for a moment. Any best practice you have about how you change healthcare systems or influence healthcare systems? Any best practice you've used for wellness?
Yeah, well, I really like these, the last two, you guys did a great job explaining things. I think that was beautiful. I'm not in a place besides home that I can make noises really, so I haven't done that as much, but definitely the breathing is really critical. The other piece I think is I do a lot of meetings where I have to bring people together that haven't talked together before, that speak different languages. And so checking in, just like before you go into the exam room, checking in before you start that meeting or before you go into that Zoom, now it's all on Zoom, but doing that breathing, and even during that, making sure that you're not breathing, you're not doing the panting breathing, that the breathing is really the deep hara breathing that makes a big difference in terms of feeling grounded and connected. And then I think it's easier to not be so worried about the outcome, to let the outcome be the outcome. And one of the lessons that I've been learning through this period of time is time is very different right now. It's just a very strange concept. Time is either going very quickly or very slowly. It's very different. But to really being mindful that things happen in their own time, and just wait and breathe with that. And if it's going to happen and ready to happen for that collaboration to work at that particular moment, it will. And if not, then, maybe it will happen in a few weeks or a few months. And I've definitely seen that flip where people aren't quite ready, but if you kind of let them sort of just talk and breathe through it, by next week they're ready. It's been really interesting that way. So that's been helpful to me.
It's wonderful. It's wonderful. Dennis, let me come back to you. You spoke earlier about building bridges where you see barriers. Any best practice you'd share for how to effect change and how to heal healthcare? What's your best piece of advice?
Yeah, this is, I would say it doesn't have to be healthcare, it could be anywhere, but certainly in healthcare it helps with there's so many boundaries. two things I'd say. One is that you've often talked about, Ginny, and we've talked about at the dojo a lot and in IZL is, yeah, breath and posture are critical, and reminding yourself and staying in touch with that all the time, especially when you're going to be in a situation where you might engage your fear, is really useful. But just being aware of your feet on the ground and having your feet be solidly on the ground, let the earth support you, as you like to say. I always thought that was wonderful because there's a lot of earth, you know, so I could use all the support I could get. So I think that's been helpful. And I think the one thing that you've often mentioned about your own teacher saying, when you're trying to connect with somebody, become the other and go from there. And I have found that to be extraordinarily helpful in terms of just meeting clients where they are, helping clients meet their situations where they are. So I would say those things have been helpful.
Thank you. Adrienne, I'd like to come back to you to bring us on home here. As you think about healing healthcare and your own place in it, what's your best piece of advice for people determined to heal healthcare? What would you say to them?
For me, in my experience, I have had, and I continue to have to train myself to get out of my own way. And I'm seeing that now, dissolving barriers and building bridges around me. I see that how I show up matters. And as Christy was saying, I don't have to do, I just allow, once I have trained my body to be the vessel that it needs to be for change to come through. I'm not done, but I'm starting to see this. And so I would say, don't forget this piece. You know, we focus so much up here, and we're all smart. And so don't forget this piece that is the agent that anything you think of will come through, right? So just be in your body and really train your body to allow what needs to come through.
I love it. Love it. Thank you so much. Thank you all. I find myself feeling better just having had this hour with you, and being reminded, as I think all of you have spoken so beautifully to, of how there's a kind of trust that can emerge through our being, mind, body as one, where we can become the other, become the situation, and give things the energy they need without attaching to the outcome, without saying it has to be this way or on that timetable, but with this passionate, generative listening that lets things come through. Thank you all for the wonderful work you're doing in the world, and the resilience and boundlessness that you open the door to for all of us. And thank you for those of you listening on recording. I wish the same for you. Let us wrap up for the day, and we'll be back in a couple of weeks with our final resonance webinar in this series on resonating with the earth. So thank you.
Thanks, Ginny.
Thank you, Ginny.